continuing our series of technology and healthcare with an emphasis on AI. Abbas, do you have any comments?
I think the medicine is going through a very revolutionary transition with AI, and that's going to change, hopefully, all for the better for the patient and health care providers. But we have to be also be cautious of the negative effect of it. Today, we use AI in administrative care, patient care, language interpretation, as well as diagnostics such as radiology, histology, pathology, as well as we use that in skin and as well as other modality in medicine, using robotic in surgery, as well as many other things to come. So, such as in drug industry for drug recovery, and be able to take many of the smaller steps so we can provide better care to the patient and more cost-effective manners.
Agree, so continuing in that discussion, today we have Dr. Bonilla, who is a family medicine physician and hospitalist, also the CEO and founder of a company called ChartNote that is working to streamline documentation for healthcare providers. So you may know that after you see your physician, he or she generates what's called a note, and that note is a medical legal document that is then accessible. Oftentimes you can see that note in the patient portal part of your chart. Usually it's in notes, a tab in those portals. So it's been over the last 20 years, we've had to oftentimes type our notes or dictate them, and it's a very tedious whole procedure to do this. It takes about, for a new patient, it'll take me at least 15 to 20 minutes to do that note. So what if we could reduce that time and effort needed to do that down to just a few minutes and have it done even better? So that's what ChartNote is doing. And I really think this is what I would call a stethoscope moment. Once this goes into the healthcare visit, I don't think it's going to come out. And so once AI enters into these visits, I think it'll become a permanent part of U.S. and worldwide medicine, and it's probably not going to be ever removed, or it'll change over time. But I think this is truly what I would call a stethoscope moment, where we'll be using this for many decades to come. The potential for this technology to help reduce provider burnout. Provider burnout, when the doctors just become very just overwhelmed with all the different demands on them, and there's no joy anymore in medicine. And I think there's potential for this to help in that regard as well. So we have a great discussion with Dr. Bonilla coming up here. Stay tuned, and looking forward to it. Good morning, Dr. Bonilla. It's great to have you. Could you tell us a little bit about yourself and what made you interested in technology and specifically AI in healthcare?
Well, first of all, thank you, Rob and Abbas, for inviting me to the podcast. It's a pleasure sharing my story and hopefully inspiring other people to join the revolution of healthcare with technology. I always been very kind of tech savvy. I'm not technical. I don't know how to code. But I remember in medical school, I don't know if you remember the Palm Pilots.
Of course, that was
yeah. So I was the one with the Palm Pilot, and then with a keyboard taking my notes in class, and so I was always at the edge trying all the new gadgets, and always I remember my dad has a business, and he sells measurement instruments, and I created a website for him, and I enjoyed so much. I was in my zone when I was like creating the website, and it was, and then on the other spectrum, the business side, I was able to sell online, and just like the dopamine hit you get from that. It's like, oh, someone in the other side of the world
Yep.
just bought something from me just through the internet. It
It
was
just
like,
works. Yeah.
yeah, it
Yeah.
was so exciting. Just tinkering with the technology, and then later on, as I got busier and started like residency and having a family, I wanted to make sure that technology was working for me and be as efficient as I could. Um, I'll share a quick story. When I was in residency, I started residency right before the transition from paper charts to electronic medical records. So my hack, it was not technological, but it was I was making these templates on just like the progress notes, the line, paper that we use, and I'll make copies with a little template for me to use to fill out, and I will use fountain pens just to be able to write faster. So every little second that you can carve to make yourself more efficient, I will use it. And it was out of necessity. Um, when I started residency, I had my first kid, and so I was juggling the kid and residency, taking the kid to daycare. Like I really had to get out of the clinic on time, to otherwise they will charge me extra at daycare. So when we switched to the electronic medical records, I there were these things called dot phrases. I'm sure you're aware, but for people that don't know what a dot phrase is macro, or like a block of text. So they call it dot phrase because usually you type a dot and then an abbreviation, and expands a block of text. So I started creating all these dot phrases throughout residency, and towards the end, I accumulated like over 1,000 of them, just in all kinds of presentations. So I'm family medicine, so I would see all kinds of patients in the hospital and the clinic. So I started accumulating all these dot phrases, and it really made me uh, efficient enough that I could get out on time in the clinic. um, and I just wanted to share this efficiency with my colleagues, and that's what I started thinking about how to do this, and that's how everything started for me in the world of technology.
It's fantastic. Yeah, I think the sometimes necessity make us to think and come across a solution that not can help us, but helps others. As you know, the AI is not only on taking notes, is in administration and in radiology, in the pathology, in robotic and surgery. So I think we are at this is the tsunami of this information. And how you see the future? How do you see these pros and cons in medicine?
Well, I think it's a revolution. AI is touching all aspects of society, but in healthcare, it really started like 3 years ago when OpenAI released ChatGPT to the public, and back then we already had a platform that was using voice recognition and this we call them snippets, but the dot phrases. So initially, right away, it clicked, the a light went off, like, okay, we can use AI to just capture the conversation and then convert it into a note. But this is just like scratching the surface. But what I wanted to share is that for the last 3 years, doctors and people in healthcare have been very resistant to adopting AI, very afraid, like it's gonna take my job, it's gonna hallucinate. And now, when I do like demos, I will just like have to tell like all the benefits, and it's gonna save you time, and this is how it works, and this is an AI scribe. Nowadays, everyone knows how AI works, and they're kind of like um, trying to catch up and adapt to this change. There's still a little bit of fear that AI is gonna, misdiagnose and hallucinate, but there's always a human in the loop, um, and just the um, the rational thing to do to proofread what AI is writing before you sign, right? So obviously there's it's AI is a tool. It's just like a surgical blade. Uh, you know, um, of course, you should be afraid of a surgical blade. It can cause a lot of harm. But if you know how to use it, you can save lives, right? So same thing with AI and technology. I mean, if you know how to use it, it will save your own life. You will avoid burnout. It will extend the years of practice, and not only that, I you will provide better care because you will be more engaged with your patient, and the patient really noticed that, like, oh, you're not like glued to the computer, like it's always typing. He's actually, the doctor is actually listening to me. But uh, like I said, this is just the beginning. There's more potential for this technology to help doctors and improve healthcare in general.
What do you think? Where is it going? Where do you think? It's before we get into ChartNote, I'm just curious. What do you think is the next? What does this look like? 5 years, 10 years? Can we even predict? Is it even possible to know?
Yeah, so I will speak from my point of view. I think what I want to bring to the world in the next year is an agent, and yeah, I'm sure you already, if not, you will in the next few months interact with agents. If you call our phone, you will speak to an AI agent that will kind of like triage your call and then redirect it. But agents have a lot of potential because they're just using speech recognition and the AI, a large language model, to process the conversation in real time. So all the patient intakes can be done with an agent. Right now, a lot of companies are using it to schedule appointments and do like very, very simple and specific tasks. But I think, at least for us, we see the agents doing patient intakes and follow ups. So it will save a lot of time. So imagine that you are a user of ChartNote and you're going to see a new patient tomorrow. So you tell our platform, hey, just give John a call and ask them for their medical history, their medications, and just full intake. And then you get all that information. And then when you see the patient, maybe you clarify some things, but all the bulk of the conversation, AI has all the patients in the world all the time. Probably better bedside manners than a lot of doctors, and it speaks multiple languages, right? So, um, and then you see the patient, and let's say it was a heart failure patient or a diabetes patient. You had things of to-dos for the patient. So next week you will call the patient and ask them, hey, did you went to the lab and get your AIC, or are you taking your Lasix? What's your weight today? And then you get that information, and you can take action on those um, whatever information the platform is giving you. But I so that I think that's where at least our platform is going. Um, but people in the EHR world, I mean, I think we're gonna see more like AI first EHRs, where instead of digging through the chart to find all their colonoscopies or all their past history, it will present just a summary, and it will just it's all about being more efficient.
Yeah, I can attest to some of the as you said, the patient and doctor relationship. I remember vividly a patient I sent that pre-colonoscopy to a cardiologist and to get the report for whether safe to do the procedure. And when the patient came back, I asked, how did the conversation go? I said, what conversation? Ask your computer. The cardiologist was just typing, look at the computer, and I had hardly any conversation. I don't think again I contact. So he says he will send the report to you. You look at your computer. Don't ask me what the doctors told me. And I think hopefully this will decrease some of that patient doctor relationship. So you can spend quality time with your patient while the scribes your conversation. And as you said, I think is human um, control of it. I think should be managed so we don't get used to this false narrative that make wrong decision. I think still I think it's like I think an AI driving car, so you still have to keep an eye on the road to make sure things are going the right direction. So yeah. So it's a fantastic time.
I want to add, and healthcare has a specific challenges that is very siloed, right? So I think, I mean, I think that has to be a bigger overhaul from the government uh, to be more open. But what AI will do is it will work through those silos. So, for example, you have your agent with a specific task of getting a prioritization, and then it will talk to the agent of the insurance company, the AI agent, and they will communicate and figure it out. Or your agent will talk to Rob's agent to schedule a follow-up appointment or a referral. So a lot of the clerical things that your back office or front office is doing, I think those will be solved with using AI agents.
Less peer-to-peer, which I hate that.
Well, but it's things that you don't want to do, right? Of course, you want to get on the phone and discuss a case, but you don't want to be on the phone for 30 minutes on hold and getting a hold of the back office just to schedule an appointment for the patient, or things like that.
Yeah, especially with the insurance company, they always like to deny things. Then you have to sit down and explain to them, go through the chart, somebody that doesn't even not specialized in that field, to convince them that the patient needs that. So hopefully they get better view of the chart and make that part easier. Rob, any other question?
Oh yeah, I would just love to hear about the so part of what my interest is more of a hobby. I've not really monetized it in any way or done a business with it. But have you heard of Peter Diamandis? He does a whole technology. Him and Ray Kurzweil and these guys. You may want to check them out. These are so Ray Kurzweil is one of the founders of these large language models, and he currently at Google, and he did that whole thing where Google predicts the next word you're going to type in Gmail. So that's Ray, and Ray has been talking about the singularity that's going to be here by about 2030 ish. This incredibly powerful system that will essentially will surpass the all collective intelligence of all humanity by the next 5 years or so. I mean, it's just mind boggling, but but fascinating stuff. I was just curious when you were doing you went from sounds like a dragon type based model where physicians would dictate into a system, and then all of a sudden you get this tool with these large language models. I was just curious to hear how that really changed the direction of your business, how that all came about, because back in 2017, 2018, that these were not even on the map. I mean, maybe we thought they might be here by the 2030s or something, but we had no idea. I'm just curious to hear how that transition happened.
Yeah, no. So back in 2018, let's see. So I was a recent grad from residency, and I had accumulated all these dot phrases, right? So every time I had a chance, I would share it with colleagues, like, hey, you just use them, right? But it was a very manual process. Like I had a Word document or Google Docs, and I would share it, and I had to import it. So I went to Amazon, self-published, and published a book, and it became a bestseller. Um, and you know, I realized there was something here, so I had this idea of creating a platform, but just to be more practical, I um, created a website and I started selling these dot phrases on an electronic format, so other people could use it. So this electronic file would work on a third-party software. I think you can still buy it. It's on the software was called Text Expander and Phrase Express, I think. And basically, you have to install that software and then use the library of dot phrases that I was selling, and then you could go into your EHR and expand this dot phrases, right? But the issue was that I mean, people were buying it not only here in the U.S. but in Canada, UK, and Australia, and but the main issue was that in the hospital, in the clinic, especially if you're at an institution, this computers, you're not you don't have admin privileges, so you can't install any software. So to be able to use my file, you had to install the software, and they couldn't. So they were like, "Why don't you like do like a web application?" That was kind of like the feedback. So it was funny how my co-founder John Bruno, he used to be a professor of engineering here at UC Davis, and actually he was a provost of the computer science department. And then he had a remote patient monitoring company back then, and he was doing a pilot in the clinic that I was working. And we met and we said, hey, maybe later on we'll start a project. So I reach out and tell him, hey, we need to do like a web application. Will you help me out? And I was like, sure, yeah. So we started tinkering the ideas, and we came out with the platform that was ChartNote. And as you said, Rob, it was just basically typing and dot phrases, and then later on we added the voice recognition, like probably a year or two after we came out. And so by the time AI came out and ChatGPT came out, we had a good platform that basically did everything with voice recognition. So we already had that voice part, and then the other part was the large language models, or what people just refer to as AI, and the AI, the voice recognition captures all the audio, transforms it into text, and then the large language model reads this text and then converts it into a note. So as soon as it came out, like, oh, this is doable. I was starting to do some tests, and I remember I sent an email, hey, would anyone be interested in this? And everyone was like, yeah, of course. So we started like did some testing, and being a small company, I was doing the processing in real time for the users. So it was a lot of hard work, and then we automized everything. But the results were just incredible, and it's super rewarding because every day we hear a story, an email, or users telling us how it really changed their life, and it's so rewarding.
Yes, I was telling Rob that is for people like myself that we are in 60s or so, is a transition, because one of many good colleagues, and Rob, we discussed that before, that they're great physician, the technology doesn't let them go forward, and they just quit. But I think that will keep them more in still can provide good medicine with some good use of technology instead of barriers to their practice.
What have you heard from patients about all this? So you got this AI running during the visit. Do patients need to consent for this? Is there how do they know their data is secure? Could you comment a little bit about that?
Yeah. It comes to mind when I was in residency, or before I was a resident, I worked as a virtual scribe. So I always had the idea of, scribes are the thing to have to help you out. And then during residency, we did a study, and just trying to prove that, you know, it will reduce burnout, and you will be more efficient. And I remember my program director was like, I don't think patients are gonna be okay with this. And because back then it was an actual, the doctor will go in with the computer and a webcam, and the webcam was like looking at the visit, and on the other side, in this case, it was right next door. But usually virtual scribes are in India or I don't know, Latin America, and they're listening to the conversation and creating the note for you. But our we were afraid that patients wouldn't be okay with this. So part of the study was to see the acceptance rate of the patients, and to our surprise, like, I don't know, it was greater than 90% of patients were like okay with this, and they did realize that the doctor was paying more attention to the patient. So this was very intrusive, right? You had a computer and a camera, and then an actual human on the other side seeing you and listening to you. So this is much less intrusive. I mean, it's just capturing the audio, and patients uh, uh, don't. I mean, there are some patients that refuse, right? But usually the workflow is the doctor will tell the patient, "Hey, I have a this tool is an AI scribe, will listen to our conversation and then create a note for me. It will help me pay more attention to you." And they're usually okay with that. And then after the fact, they really realize that it's actually helping the doctor pay more attention to the patient and being more interactive. So in that case, the patient are usually okay with the use of this technology. On the security part, we take it very seriously. So obviously we're HIPAA compliant, and in Canada we're PIPEDA compliant, and in Europe we're GDPR compliant, and then we have a SOC 2 certification. So it kind of like reinforces that everything we do is private and secure. And there are other things that we could do and that we haven't done because we haven't worked with bigger institutions, but there's like the high tech and other things that at some point hopefully we get to to work with institutions that require it. It's a lot of work, but we take it seriously. We recently got our SOC 2 certification, so we're very happy, and has opened a lot of doors. And it's just out of necessity, as you work with bigger institutions, they require proof that you're actually handling everything with as you should, right? So they don't want to leak any patient information.
Does the patient data, is it the patient data in the system, in the AI, does it disappear after the visit is complete or and the note is generated? Does that data go away, or is it retained in any way?
it's depending on the policy that you set on your account. Some people retain the data in our servers, and so you have your notes there. Some people just wanna, as soon as the you're done with the visit, then it disappears, and so we don't. So we give the option of the users to decide what they want to do with the data. But the ones that are keeping it in our servers, I mean, we're taking all these steps to make sure that we're going by the rule.
What about provider satisfaction burnout? I'm really curious about that because as I was learning about this tech and all the different nuances of it, that was kind of the aha moment for me. Was like, wow, this really is in terms of what hospitals or offices can do to try to reduce burnout. It's probably not a I've seen all the things like start a hobby or or a 10-hour retreat or all these things which I understand maybe may have some value, but most of the my colleagues that I speak with are like, yeah, I don't do any of that. That's not going to help me. That's just more time I need to take away from my family or other duties to do the retreat or what have you. But this, I think, has potential. Could you comment on how what you're hearing from providers?
When I first encountered this technology, even before like OpenAI came to place and really exploded this, I remember there was a company, I can't remember the name now, but was pitching this idea, and it was so incredible. It's like, oh, come on, this is not gonna work. And so I get it that people say, I mean, it's never gonna write the notes like the way I write it, um, and that might be true depending on the company you use. But with ChartNote, the good ones really can mimic your style, and the but I was just talking to a colleague the other day, and he was making fun of a colleague that he referred to ChartNote, and he was saying that now he comes home on time, and he's done with notes, and his wife doesn't know what to do with him. So it's it really, I mean, the surveys that we've done, just informally, just like sending to the users, 90% save 1 or more hours of time every day, just in terms of documentation, and I don't know, I think like 70% is 2 or more. And this is very depending on your style, but if you're one of those people that really skips lunch and then stays an hour extra after clinic finishing your notes, I mean, this is just life changing. It really listens to the conversation, and then creates a note, and it depending on the AI script that you use. Our vision is that we let the user customize their note as much as they want, so that the AI really writes a note in their style, and that it's minimal editing. Because what happens a lot of times is, I mean, there are like 100 AI scripts in the market, and you know we're all using the same technology. Kind of, it's the voice recognition part that creates a transcript of the audio file, and then the AI or the large language model. And there are only a few vendors. It's OpenAI, Anthropic, and Google, and Meta. So we all use a variation of those, and then you create a note, and the AI is super good at summarizing the transcript, but then it's about how you package the sausage, right? you So what we do is we let the users structure the note the way they want it, and then um, tell the AI how what kind of style they want it, and if they want a bullet point or a narrative, or if they want to calculate a risk or some score, or I mean, it's just mind blowing how specific instructions you can tell the AI, and it will follow those instructions. And then can suggest some billing codes, and do instructions for the patient. And then in the context of the note, we have Copilot. So if you want to write a referral letter, it will take that information and create a letter. So, it's just what it used to take, several minutes, at least 5 minutes to type a quick note after the visit. Now is instant, and then you just proofread it and then transfer it to the EHR. Another thing that we have is we we don't do a true integration with the EHRs, but we use a Chrome extension. And so if you're using a web-based EHR, like, I don't know, Practice Fusion, Athena, eClinicalWorks, any web-based EHR, what the extension does is detects the fields where the note should go, and then with a click, it inserts all the note in the right fields. So it's kind of seamless. And we're starting to do some real API integrations with EHRs that are not web-based. So what we envision in the probably by the end of the year is a little bit more integration in terms of, if you're gonna order a lab, it will order it for you, and then you sign the order, right? So things like that to make it more efficient. But the bulk of the time saving is really the creation of the note. And sometimes it actually pays more attention than you. It has happened to me that I'm proofreading, and I read something like, "Oh, right, yeah, she mentioned that," and I just forgot about it. So sometimes it's a better listener than you, right?
Yeah, I have attest to that. I've been using it almost for a month and a half. And number one, I think engagement with the patient has definitely better than writing note by hand or typing or just there. And then when you finish, the summarization is very good, as you mentioned. The patient may come for me for screening colonoscopy, but I also try to teach them about how to prevent you know diet, exercise, and all of that. At the end, just goes to help and make it a nice summary. As you mentioned, sometimes surprisingly, you forget what you conversation, then you bring those things up. Even they mentioned about that, the previous experience or the family, or I have noticed that even if the husband there, he recognized the husband is talking and says the husband mentioned this, or how did you know it was husband? I think based on one time was a son, and I know whether recognized is younger than they're even recognize that. So no, it's really, I think for me was the time, especially writing types and the patient interaction and the detail of the conversation, because I usually go more than just the actual procedure. You want to just something to prevent, and that really has helped me, and helps the note be ready in 2-3 minutes, so you can even print it, give it a copy to the patient for their instruction. Instructions are very good, and you can do them in different languages. Is that correct?
Yes, yes. So the visit itself can be in, I think, more than 35 languages. The note can be also written in different languages. Our main user base is here in the US and Canada, but it can be written in a different language. And then patient instructions, it can be also printed in 35 different languages. And yeah, no, it's impressive how it captures all these details. And I was gonna say it becomes critical when a lot of clinicians will just go patient after patient and then leave the running the notes right at after the lunch break, for example. So by that time you forgot half of what happened during the visit. And then worse if you leave it for like next day or the weekend. That like that at that point you're just inventing what happened, right?
Dr. Bonilla, I have some questions about timelines of this. When do you think that we'll reach 50% adoption in terms of, say, half of US healthcare providers using some type of AI tool? And when do you think it'll become like a stethoscope where we just like walk in? I know some providers don't use a stethoscope, but vast majority have some kind of listening tool on their collar or in their pocket. When do you think it'll become like just normal that like everybody's using it 100%?
So this year I've noticed a lot of institutions like reaching out, and they're really interested in uh, getting on the wagon and adopting this. So within the next 2-3 years, I think this is going to be the gold standard for documentation. And when I say the gold standard is people that want to use technology, because for example, we have Dragon dictation, right? And even though it's clear that it will make you more efficient, some people they just want to type. That's how they want to do it. So those people, I think uh, we won't get those users, but if you have a minor small interest in improving your life and, and being more efficient, I think it will make sense to adopt this technology. So I think this is gonna be as common as Dragon dictation was a couple of years ago. I think in 2 years is gonna completely replace. I mean, it's still a good part of the for, and at least in our platform, it's still a feature because at some point you want to edit something and you want to just dictate. You can also type, but I mean, so it's part of uh, the tool sets that you have at your disposal to be more efficient.
I'm just, I just one other, maybe a little bit of a selfish question because we use Epic currently. Does it integrate with Epic?
No, we haven't created an integration with Epic. Probably next year. It's a big undertaking. So our approach right now is we started, and this was very intentional because when we started, we were very small. So we started direct to consumer, and our goal was to capture as many clinicians as possible and then do like bottoms up growth. So some physicians started using it in the clinic, and then that opened the door to speak to the admin and purchase a team for all the clinicians. And little by little, we have been penetrating clinics and small hospitals, and we're not pursuing all the big hospitals with Cerner and Epic because we want to avoid all the integration process. We're still, I mean, half of our users are using Epic and Cerner, the personal accounts, because they use copy paste the note from ChartNote, right? So you have Epic on one window and ChartNote on the other one. You just copy paste the note, right? I mean, it's simple enough that you can just copy paste a note. But in terms of selling to enterprise, I think that's coming next year. We're getting bigger and more. It takes a lot of developer hours to work on these things. So right now we're uh, going into doing a lot of work under the hood to get ready to bigger expansions and working with bigger hospitals. And so yeah, probably next year.
Fascinating. I think you're going to be very, very popular here, as you are already popular, but I think it's going to be kind of it sounds like an explosion is about to happen here, and as everybody converts over, and what it seems like is going to happen is it would become essentially standard of care to use some type of AI tool rather than not, just because it's just impossible to capture the entirety of the visit in a note. As you said, there's always things that we forget, or someone mentions they have leg swelling, but we was just like, it's just so minor. We may not even mention it.
So, there's a lot of competition. There's a lot of companies that are doing something very similar. My personal passion is helping. I really believe that supporting um, primary care and private practices, private doctors, is the way to go to improve healthcare, at least here in the U.S. Because when you work for these larger organizations, I mean, it's great, but you don't. It adds to the burnout, which is on the first place why I started this company, to help doctors reduce burnout. So I think empowering doctors to use technology to become more independent and treat their own patients, and uh, I think that it's where we want to uh, uh, develop solutions that help doctors address that. And so um, on top of the AI scribe and creating notes, we really want to create a platform that helps the doctor um, uh, go be able to take care of more patients without the burden of all the clerical stuff that you have to do. So I think that primary care doctor usually has a patient panel of about 2,000 patients. So I really believe like in 5 years, it's probably gonna double or triple, um, but with the same or even less burden in terms of managing the patients, because there's going to be so much automation. That's where I think we want to be as a company. Not just the medical documentation, obviously, is the most obvious part that we want to solve, but dealing with the whole process and all the little tasks that you have to deal with as a clinician, all the admin burden really helps. The other thing is messages, uh, but that requires more EHR integration. So,
And I think the pre-charting is, I think, one of the key things, reduces the time in the office. So if you can get it, from the last visit, the radiology, the labs, and get them ready before you go to see the patient. Because many times today, I go to the patient came for a reason, they had X-ray labs, then you have step out, ask, get them the thing. So if you can, you can do the pre-charting there, it makes the interaction and quality of the visit much better than have unnecessary repeated visits.
yeah, definitely. I mean, it has a lot of potential, and like I say, we're just scratching the surface.
Well, how our audience can find you? Can you give us how they can reach you, and you have any last comments for us?
In terms of social media, the LinkedIn, I think, is where uh, I don't like social media very much, but that's the one that I open occasionally. And so I'm always there. And, you can always join the platform. It's free if you're a clinician. And if you're not a clinician, just tell your doctor to use ChartNote, and they will pay more attention to you. and we're super responsive to feedback. So if you send us an email, I respond a lot of emails from users, and now we have a bigger support team. But I'm very involved in the direction of the company, and I use the product every single day. So I I know our limitations and where we want to go and the things we want to solve, but we're always open to ideas to improve the platform.
It was great to have